Welcome back. Now that we are almost 11 months into the pandemic, it is taking a toll. It's causing a lot of stress for people of all ages. Joining us now from Niagara Health, the Chief of Mental Health and Addiction Services, Dr. Maxine Lewis. Welcome, Dr. Lewis.
Thank you very much.
Can
Nice to be here.
Can we begin talking about young people? Because to me, right now, they are the ones that I'm really concerned about. 11 months in almost. What kind of toll is this taking on young people in particular, and how long will the effects of this last, the longer it goes on?
Yeah, well, we're certainly seeing an impact on youth. I mean, there's been lots of studies of school-age children, which has demonstrated that there's an increase in anxiety and low mood in children, but also in their mothers, which also has obviously an impact on the children. With older youth, sort of 18 to 25, we're also seeing other impacts. Those of university age students are presenting more with similar issues: anxiety, alcohol, increased alcohol use, increased substance use. So absolutely, it's had a toll on that group. I mean, how this is going to impact generations going forward, I wish I had a crystal ball. I think it has to have some impact, and there's been some discussion regarding whether we're going to see sort of difficulties with children, particularly going back to school. There's particular concerns about whether they're going to be anxious about their safety when they go back to school and get back into the swing of things. I mean, obviously, we counter that with also the positive benefits of being back with your friends and being back in a routine, because that's obviously the lack of those is having an impact on children as well.
What kind of an impact on all ages is caused by the fact that there's so much uncertainty? We don't know what the next decision is going to be by the provincial government, by the federal government, and especially you mentioned schools. Schools don't know when they're going to be able to open, and then they did open for a little while, then they were closed. So all of this uncertainty leaves people with the feeling of, oh my gosh, here we go again.
Think it's that uncertainty that's really the hardest to deal with. And especially now, the hope of having a vaccine and then having that sort of paused has really sort of impacted people's morale generally. I mean, I know for sure in healthcare it's had an impact on us, but sort of community wide, it's essentially, when is this going to end? And I think that's particularly challenging. I mean, as humans, our mental health is really dependent on having some form of control, or feeling that we have some control over our life. And I think the important thing right now is to actually sort of focus on those things we do have control over. We have no control over vaccine delivery unless we're Trudeau. We have control though over our daily life and how we sort of function day to day. And I think it's important right now more than ever for us to really sort of focus on sort of those small wins, really.
From a Niagara Health perspective, Dr. Lewis, what has been done internally to sort of beef up what Niagara Health offers for people mental health wise? I know you've posted some great tips on the Niagara Health website on how to deal with some of these stressors, but internally, have you hired more staff? Is there daily meetings of a mental health team and looking at strategies in the long run?
I've been so impressed with our team in the mental health and addictions program in Niagara Health. Really, I mean, right from the beginning, we pivoted very quickly to offering virtual care. And we were already one of the leaders in the region for offering virtual care, but we've really taken that on and sort of bolstered that up. In our emergency department, we are recognizing that because we have an increase in people coming with anxiety and depression, we're actually doing regular phone check-ins after somebody is discharged from the emergency. We're linking with the community much more than we ever have done in terms of bolstering up supports when people actually leave hospital. And you know, as you said, sort of regular strategic meetings, really, to sort of see how we can improve the care we're delivering. We haven't actually brought more staff on. What we've done more than that, is really redeploy people to actually areas where the need is
Right.
greatest.
What kind of strain has this put on the mental health wing at the St. Catherine's Hospital?
I would say that it's challenging. I mean, we've had. I mean, moving from face-to-face visits to virtual care is a challenge because we all like to see people in person. But I think that our team has risen to that challenge, and we're all supporting each other. I think hospital wide, really, there's a great sense of we're in this together and we'll work as a team. So we're there to support not only our community but also our healthcare partners.
Dr. Lewis, thank you so much for sharing your time with us today.
Oh, it's a real pleasure. Bye then.